Good afternoon, everyone. Hello, I'm Jenny Medlin, your Education and Outreach Specialist with your Missouri LAGERS, the local government employee retirement system. Thank you for joining us this afternoon for our webinar over the Social Security Administration. As you're aware, your benefits through LAGERS are just a piece of your future financial picture. So it's our privilege and with glee today that we welcome David Seymour, a senior public affairs specialist with the Social Security Administration. David, are you able to join us today? I know we've met in advance.
Yes, I am. And hopefully this device that I'm coming to you from will work better than the one we were trying out earlier. Right?
Perfect. Yes, you're coming through loud and clear. Image is perfect. And so it looks like we have over 60 currently, and there were over 133 who had registered. So again, it's a pleasure to have you here today. For those members in attendance, please know that your microphone and your video camera have been disabled. However, throughout the presentation, we do encourage that you submit questions using the Q&A feature that you can find typically at the bottom of your screen, or you're welcome to use the chat feature. I'll be on the sidelines helping to field those questions, or rather promote them to David throughout. But at this time, I'd like to hand it over. Thanks again, David, for being here.
Thank you, Jenny, so much. I'm going to make a little change here to my headphones, so that way, in case my dog barks or something like that, it doesn't interrupt any of us here today. So hold on just one second and get my slides up here too. And there we go. Okay, hear me okay? We good? All right, good. All right, wonderful. Let me go ahead and get my slides up here so that we can truly get this show on the road. Almost slideshow. There we go, I think. Very good. And you can see the first slide, right? All right, great, wonderful. So I'm really excited. I'm always excited when I get an opportunity to present with Missouri LAGERS, because it's a great audience. We know you guys need this information, and anything that we can do to come and share that with you in advance, right? So that you're more prepared. That's what it's really all about here today. And so on this opening slide, you see a variety of people, and that is very intentional because, well, Social Security affects all of us, right? And it's important to all of us. But of course, today, what we're really going to focus on are things related to pre-retirement, right? What are the things you need to be aware of as it relates to kind of that next phase in life, okay? And so we'll explore some of those topics here today, but you're probably wondering, like, you know, who is this guy? Why is he really even qualified to share this information today? And as Jenny said, I do work out of our regional office here in Kansas City, and I am the senior public affairs specialist for the agency. So we do activities like this and many others throughout the 4-state region, so Missouri, Iowa, Kansas, and Nebraska. And I got my start with the agency about, what did we say? I think I did my math earlier there, Jenny, 18 years ago, right? In 2005. Fortunately, I have the date on the slide there, right? So it can, it helps kind of refresh my memory, right? Yeah. So I got started 18 years ago as a claims specialist. So the very person that you would talk with or communicate with when you were filing your claim, right? Helping you understand what your options were and navigate those choices a bit. And then I spent some time as a supervisor in one of our field offices. And then the remainder of my career really has been in the public affairs realm, doing events like this, engaging with various individuals in the community, helping share the good word, if you will, about Social Security. And then as a training instructor. So I was part of a team that helped train new claim specialists all across the nation, right? So it's been a great run. I can't believe it's been 18 years, but I know that what I do every day makes a difference. So I think that makes the days go by a lot quicker, right? And a lot more enjoyable. And so hopefully you'll feel that enthusiasm as we go through the presentation here today. And so what's our agenda here today? Of course, first and foremost, we're going to talk about retirement benefits, the basics. What do you need to know? How do you become eligible? What are some of the filing options and things that you want to take into account? We'll also talk a little bit about survivor benefits, right? We don't like to think about death, but the reality is that it happens, and sometimes that can create additional benefit opportunities. We'll talk about some other considerations that you want to have in mind when it comes to filing for benefits. These are not things maybe that are first and foremost in mind, but they may determine if you file sooner rather than later, okay? And then we'll kind of move away from a discussion of cash benefits, and we'll talk about filing for Medicare, right? That is kind of its own animal, if you will. And we're not going to cover all of the things related to that, but we're going to talk about the basics. What are your options for filing for Medicare? Can you wait a little bit longer, or do you have to file at age 65, right? Which is a common thought out there. We'll round out our time together today by talking about your My Social Security account. Hopefully, most of you have already created it with some of the information that Jenny and her team were able to share before today's event. But if you haven't, that's okay. I'll give you some tips. We'll talk about what some of the benefits are of having your account. And then, of course, at the end, we'll have time for some question and answers that I believe, Jenny, you said they can submit through the chat or through the Q&A function, right? And
Yes.
Wonderful. Yeah. And we'll take a moment to, before we go into talking about Medicare, I'll stop there as well to see what kind of questions have come in at that time. Okay. So that'll be some breaking points there for us, if you will. Okay. So let's get into it, right? Most of you know that, we have this disclaimer here, right? The information I'm sharing today is current right now, but sometimes things can change, right? If there was a change on the horizon, I would tell you about it, right? But that's why we really encourage folks to engage with our website, right, at ssa.gov for up-to-date information on, on anything that may change down the line. And so when we're talking about Social Security, most of us know that it is not meant to be the sole source of income for us when we move into retirement, but it is an important foundational step, right? Hopefully through other seminars and other educational opportunities through LAGERS, you're learning about, pensions and other savings and investments, other things that you might be able to plan for in retirement. But of course, Social Security is that foundational step, right? And it gets started with a small acronym called FICA, right? The Federal Insurance Contributions Act. This is the act that says a portion of your wages will go towards your eligibility for Social Security, and that your employer will match your contribution, right? So when you think of Social Security, it really is kind of a lifelong partnership between you and any employer that you may be with, right? And so you contribute 7.65%, your employer matches that, so a total of 15.3% of your gross wages goes into your eligibility for Social Security. And then a smaller, portion of those taxes goes towards your eligibility for Medicare, right? And so when we're talking about Social Security, not only are we talking about retirement benefits, but also disability benefits in case you're no longer able to work. And of course, we'll talk a little bit today about survivor benefits. So, these ladies are obviously having fun in their retirement party. Hopefully you'll have as much fun as them or even more, okay? And so how does the party start, right? Well, you qualify for retirement benefits by earning credits when you work and pay Social Security taxes, and you need at least 40 credits, which is about 10 years of work, and you have to be at least age 62 or older. Now, those are the bare minimum requirements, right? But we're just talking bare bones here, okay? When we're talking about the value of a credit, here in 2023, the value of a credit is $1,640 in gross earnings, right? So if you make at least that much, you earn one credit, multiply that times 4, which is the total number of credits you can earn in a year. Then If you've earned $6,560 in gross earnings this year, you've already earned your credits, right? And then any earnings you have above these amounts that you're seeing on this slide is what goes to increase your benefit amount. Okay, so again, this is just kind of the base level here, right? Getting insured. How do you become insured for a benefit? That kind of leads us to the next question, right? How do we actually calculate your benefit amount? Well, we are looking at the earnings that are reported to us, to Social Security, right? Meaning those earnings that have been taxed. And so when we're looking at your earnings record, what we do is we take all of the wages that are posted to your record and we adjust them for changes in wage levels over time. I'm going to pause there because there's a lot of words there, right? We're getting into math realm here, right? And that's not always everyone's strongest subject. What step one represents is a process called indexing, right? So think about those earnings that you had maybe in 1995, right? Or in 2000. Maybe those were good earnings at that point in time. You know, maybe you were making quote unquote good money at that point in time. But the power of those dollars now, right, is nowhere near what it was then, right? So by indexing, we bring all of your earnings, right, historical earnings, we bring them up to today's dollar value. So when we're computing your benefit, we're always using indexed earnings as part of that computation. If we didn't, everybody's benefits would be significantly lower than what you see on your earnings, what you see on your Social Security statement. So in step one, right, we index your earnings. And then in step two, we find the monthly average of your 35 highest earnings years, right? So we're not looking at your last three or your highest five, or, you know, maybe some things that a private pension, you know, system may do. We're looking at your highest 35 earnings years, and we're finding the monthly average of those earnings. And then that ends up being the averaged indexed monthly earnings, right? So that's kind of the starting point by which you see those estimates on your Social Security statement. Okay. So that's kind of the details of how we compute your benefit. Now that kind of leads us to another topic that may apply to you if you have worked somewhere where you did not pay into Social Security and you are eligible for a pension from that work. Okay, this is what's called the Windfall Elimination Provision, or WEP, right? That's kind of the common acronym out there. This is if you have worked somewhere where you did not pay into Social Security, meaning those Social Security taxes were not withheld from your wages, and you are due a pension from that work. If that's the case, right, we have to take into account that non-covered pension when we are computing your Social Security benefit amount. If you're going in to look at your Social Security, into your Social Security account, and you're looking at your information, you will not see the effect of WEP on your Social Security benefit, right? Because we don't know anything about your non-covered pension, but we do have a calculator there that is available right in there through your account that you can use to determine if WEP would reduce what you could receive from Social Security.
Great. And David, if I may interject real
Please.
fast for our membership, thank you. Many loggers members contribute to both Social Security and loggers, or rather your employer might contribute for you. So many of our members through loggers are eligible for full Social Security benefits as well as their benefits through loggers. However, if you work for an employer who has an L11 benefit program through Missouri Loggers, that L11 is an indication that you do not contribute to Social Security. Therefore, your employer was able to adopt a 2.5% multiplier for you. If you're currently or have worked in a position with a 2.5% multiplier from loggers, that is the service that David is referencing that would impact potentially your benefit from Social Security because of WEP.
Excellent. That was a great description. And I'm so glad you did that, Jenny, because I have no knowledge of that. So if there are questions about that particular L11, I think what you said, you're going to be the person to handle those, right? Yeah.
Happily, yes. But that's a
Right.
great thing to bring up because WEP impacts a small portion of our membership, but not everybody.
Sure,
So thank you.
sure. Wonderful. So with that in mind, that kind of leads us to the $1,000,000 question, right? When is the best age to start receiving my retirement benefit? And the real answer to that question is it depends. It depends on a lot of different factors, right? Your health, your financial obligations, what you want to do. There's all kinds of things, right? But what we're going to talk about right now on this slide is the relationship between your age at the time that you choose to file and the benefit amount that you would lock in at that time. Okay, so we learned in the slides, in a few slides ago, that the earliest you can file for a retirement benefit is age 62. And we see that reflected here on the further left hand of this chart. If this individual in this example files at 62, their benefit would receive the maximum reduction because they're filing at the earliest point in time. Okay. In this example, this individual has a full retirement age of 66. And if they waited until their full retirement age to start their benefit, it would be $1,000. That's the maximum benefit payable on the record. Okay, but if they started at 62, right, they'd be eligible for $750 a month. For every month that you wait after age 62, your benefit increases a little bit. We see that increase represented here on a yearly basis. And then, of course, if the longer you wait, the closer you get to your full retirement age, the higher your benefit is. Then I know you also see dollar amounts after full retirement age. And what those represent are delayed retirement credits, or DRCs. So you would earn delayed retirement credits for simply waiting until after your full retirement age to start your benefit. Those credits accrue 8% for every year that you wait after your full retirement age in this example. Okay. And if you filed at any point along that continuum, then we would give you credit, based on the months that had already accrued. Right. So in this example, you can see there's a distinct advantage in waiting even just a little bit longer, right? There could be a distinct advantage in waiting just a little bit longer. There's no requirement that you have to continue to work in order to earn these delayed retirement credits, right? It's just for simply waiting until after your full retirement age to start the benefit, right? So in this example, if this individual waited until 70 to start receiving their benefit, right, their benefit would be 32% higher. That's a significant rate of return in a very short period of time, right? So if you got a good life expectancy on your side, or, you have some other things in play, it can be advantageous to lock in at that higher benefit amount because that's what you would lock in at for the rest of your life. Right? Things to think about. You may choose to file early, but it's good to know what your options are along that continuum. On this chart, we take a bit of a closer look at the relationship between your year of birth, what your full retirement age is, and then what reduction factor would apply if you filed at the earliest point in time based on your full retirement age. Right, so in the previous example, we know that the person was born between 1943 and 1954 because their full retirement age is 66, right? And we saw that 25% reduction if they filed at 62. So, I don't need to see any hands here today. We don't need any confessionals in the Q&A about your date of birth or anything like that, okay? But you can see here on this chart kind of where you fall in terms of your full retirement age, right? It's probably 66 in a few months or We may have some folks in the 67 category. I'll put my hand up for that one. Okay. And so that's your full retirement age. And then if you file early, then you see how much your benefit would be reduced at the earliest point in time, which again is age 62 for everyone. Okay. So I made some reference to the WEP calculator earlier, for individuals that may need to use that. But of course, we've got lots of other calculators that are very easy to use on our website. You don't need to be an accountant. You don't need to be a licensed financial advisor to use our calculators. They are meant for the public to use, right? So maybe you want to kind of mess around and see about life expectancy, or you want to take a look at, what if I filed at, 63 and 8 months, or, 66 and 10 months, or whatever that kind of those magic dates might be. You can do some playing around and see, okay, if I worked a couple more years and I make this much money, that's how much it can impact my Social Security benefit. So we encourage you to check those out. Everything on our website is free. So for those of you who have not really been on our website before, you'll never be charged, right, for using any of the services. If you are on a site that is trying to charge you, run away. That's not our site. That's not us, okay? Or report it to us too, so we can go after those folks, right? So, okay, we've kind of set the stage for how you would be eligible for benefits, and then, some things to consider about when you might file, right? But of course, whenever we take an application for Social Security benefits, we're always interested in anyone else who might be eligible for benefits on the record. So when you file your application, whether you file it online, whether you do it over the phone or in one of our offices, we are always going to ask if you have any minor children. Right? So any children younger than 18 or between the ages of 18 and 19 and still a student in school, in high school. We're also going to ask, do you have any disabled children? And what we mean by that are any children who were found to be disabled before the age of 22. We'll also ask if you're currently married and if you had any previous marriages, and how those marriages ended, right? If they ended in divorce or if they ended in death. And we'll talk about survivor benefits here in a second, okay? But for right now, everyone is alive, okay? Everyone is still alive. So we're gonna ask these questions on the application, and it's not because we wanna know all your business, but it's because we wanna know who else might be eligible for benefits on your record. So you could potentially be eligible for a spouse benefit, meaning you could receive your own retirement benefit and receive an additional benefit as a spouse. We're going to look at a good example here in a little bit about how that works, okay? But the basics of being eligible, again, that age 62, right, is the earliest point. Or if you're caring for a minor or a disabled child, you could receive benefits prior to age 62. And divorced spouses, there are a few additional requirements, right? You can't be married to someone else at the time that you're filing for a divorced spouse benefit. The marriage to your ex had to have lasted at least 10 years. And your ex has to be of age, right? So they have to be at least 62 or entitled to disability benefits for you to become entitled to a spouse benefit. Okay, so that's kind of the technical elements there, right? Just so you know, whenever you file for benefits, we're always interested in anybody else who might be eligible. So let's take a look at this benefits for a spouse situation here, right? Sometimes a lot of people are not aware of this, so we like to be proactive in helping people understand this a bit. So we're talking about benefits for a spouse. Again, this means that you could receive an additional benefit, right? Your own retirement benefit plus a spouse benefit. And the most that you could receive as a spouse is 50% of their unreduced benefit. If I'm already losing you here, no worries. We're going to have an example on the next slide It's got numbers, it's a scenario, it's kind of more like a story problem, right? Anytime you file for benefits before your full retirement age, there's usually some sort of a reduction, right? Because you're filing early. One exception to that is if you were if you're caring for a minor or disabled child. And anything that you would receive as a spouse does not reduce what your spouse would receive. Right? And if you are eligible for a spouse benefit, we are going to combine it with the benefit that you're due on your own record. Right? And the spouse benefit is payable when your spouse begins receiving benefits. Okay. So like I said, the part of me kind of hates this slide because it's just full of definitions and it's very abstract, but things will start to come into play here. Okay. So we have an example here, right? We have me and my husband, Joel. Okay. The numbers are fictitious, okay, but they serve to tell the story here. And so what we do is we start and I'm coming to you from a claims specialist mindset here, okay? What we do as a claims specialist is we start by looking at the maximums due on both records, okay? And so we'll start with mine. At my full retirement age, or FRA, as you see the acronym there, I'm due $1,200. So we know based on that alone, the most that a spouse could receive on my record is $600, right? Because that's 50% of my maximum benefit amount. Okay, so we'll kind of put my record to the side here for a second. And now let's take a look at Joel's record. Joel is due $400 at his full retirement age. So because Joel's maximum benefit, right, meaning what he's due on his own record, is less than the maximum spouse benefit payable, he's going to be eligible for an additional spouse benefit. How much? Well, we see pretty simple subtraction there, right? 600 minus 400 equals 200. So how does this really work out, right? So scenario, Joel files for benefits, right? We pay him $400 or some fraction thereof, right? If he's filing early. And then he'll be eligible for a spouse benefit of $200 or some fraction thereof if he's filing early. And he can receive that benefit as long as either I'm filing at the same time or I've already started receiving benefits. Now, in the second example down below, Joel is not going to be due anything as a spouse because his maximum benefit exceeds the maximum spouse benefit payable on my record. All right. So usually when it comes to this slide, the light bulb goes off. People get it. It's like, oh, okay, I see what's going on here, right? And if this is still too much for you, right? I know math is is not always our strongest suit. We do have a spouse benefits calculator on our website that you could use, right? If you're not sure, so you may want to compare information, once you have a chance to do that with your spouse.
And to confirm, David, if a spouse's benefit is lower than the worker, she would receive at full retirement age at least half of his benefit. That came through in the chat, but I think in seeing the demonstration there, it'll be dependent upon if indeed her benefit is less than half of what he was expected to receive, then she could anticipate receiving the difference.
Right, exactly. Like let's modify if we were to say that Joel did not have an earnings record at all, right? Like let's say it never had any earnings, right? Then the most that Joel could receive as a spouse would be $600, right? It's just that in this first example, right? It's just first we have to pay him what he's due on his own record, and then we'll pay him an additional spouse benefit. So the combined payment that he receives is equivalent to the maximum spouse benefit payable.
Very good.
Yep.
Thank you.
You got it. All right. So with that, usually with that discussion about spouse benefits, it's a great segue into talking about survivor benefits, right? Because the reality is it happens, right? So what are some of the options? Well, you'll notice a slide that is very similar to one that we just looked at a few moments ago, right? Survivor benefits are no exception. We're always interested in who would be eligible for benefits on the record. So any minor or disabled children, like we talked about before, and then of course, any surviving spouses, right? Whether it was the current spouse, right? The person that they were currently married to, or divorced spouses. And this is where this is where some additional benefit options can come into play, right? So you could be eligible as a widow, right? Or a divorced widow as early as age 60. That is a full 2 years earlier than a retirement benefit on your own record. If you are a disabled widow, you could be entitled as early as age 50. And then, of course, if you're caring for a minor or disabled child, you could be entitled as a widow at any age. Right? So this can create some additional benefit opportunities, right? So that you could leave your own retirement benefit alone, right? The benefit that you would be due based on your own earnings record, and perhaps collect a survivor benefit first. And that is exactly what is kind of highlighted here on this slide, right? And so on the left-hand side are the options or the details of what is in play whenever we are all alive, right? And on the right-hand side is when we're talking about a survivor benefit. So you see the difference in that first section of the chart there, the difference in age, right? 62 versus 60 or age 50 if disabled, right? The most that you could receive as a spouse while everyone is alive is 50%, like we saw in the example there, right? But as a surviving spouse, the benefit is higher, right? So 71.5% of the maximum benefit at age 60. And then similarly, that's the earliest point in time. So if you wait, the benefit could be higher, right? The closer you get to the full retirement age, in each instance, right, is the higher the benefit would be. Okay, so some things to keep in mind, right? It may not always be an option, but if you're thinking about benefit options, you may not have thought about filing for a survivor benefit first, and maybe letting your own benefit grow and accrue those delayed retirement credits, right? Just things to think about. Now, similar to WEP that we talked about earlier, the kind of other side of that is government pension offset, or GPO. GPO would apply if you have a non-covered pension, right, like we talked about earlier, and you become entitled to a Social Security spouse or widow's benefit, right? So WEP, like we talked about earlier, would affect or could affect the benefit that you're due on your own earnings record, whereas GPO could affect a benefit that you would be due on a spouse's record. Okay. And GPO is a little easier to compute. We take into account 2/3 of your non-covered pension. Right. So, and then if that's more or less than your Social Security benefit, then that would determine how much you would receive. And of course, just like WEP, we've got a calculator for GPO on our website, right? So you can kind of crunch that. I'll crunch those numbers if need be. Okay. Now let's talk about some other other considerations, other things to think about when you're trying to decide, should I file for a retirement or a survivor benefit? And one of those is, do you plan to work and receive benefits? If you do, that's great. What you need to know is that there is an earnings limit that applies to you as long as you are under your full retirement age. Okay. So if you are, 60, 61, 62, 63, those earlier years, there's a lower earnings limit. That limit right now, this year in 2023, is $21,240 in gross earnings. If you make that amount or less, you're fine. You can receive your benefits without any kind of reduction. If you make over the limit, then you would have to pay Social Security back $1 for every 2 that you make over the limit. The year in which you reach your full retirement age, that earnings limit is significantly higher. So this year, that's $56,520 in gross earnings. That limit only applies to you until the month that you reach your full retirement age. And if you earn over it, you'd only have to pay us back $1 for every 3 that you earn over the limit. Once you reach your full retirement age, there's no limit, right? You can go out and make your millions, right? That's what I would say to people. And, sometimes I'd get some interesting responses to that, right? But it's true. You could go out, make your money, and it would not reduce what you would receive from Social Security.
So you're saying save your $1 million idea until after you've reached FRA or FRA, right?
That there could be wisdom, right? Or just wait
Yeah.
to file for Social Security, right? However it is, right? There's many ways to attack it, but yes, to avoid having your benefits withheld, wait, right? Wait until your full retirement age, right?
And David, with that, so seeing how a benefit can be reduced by choosing to return to the workforce, is their Social Security benefit or our Social Security benefit also recalculated though annually to account for the new credits and earnings we continue to receive?
They are. Every year, we review earnings records to see if there are additional earnings posted. And so remember earlier how we were talking about we use your highest 35 earnings years, right? So we will recalculate to see if maybe one of your more recent years of earnings can replace one of the earlier ones, right? And if so, then we'll send you a letter and say, hey, yeah, we see that you're due a benefit increase. Now, some people get excited by that, and they think, oh, I can significantly increase my Social Security benefit. It's still a law of averages, right? So we're still looking at an average of 35 years. So in order for it to be a big increase, your earnings would have to be substantially higher than your previous years, right? But maybe for some folks, maybe who don't have as many years of earnings, right? Those additional years, any new earnings could have a bigger impact, right, on their benefit amount. So yeah, great question.
Great. And then taking us back to Social Security eligibility ages, I know they can apply as early as age 62, and then in the graph it showed as late as age 70. Is there any benefit to postponing applying for Social Security benefits beyond age 70, or is that kind of the last eligibility age?
There is not. At that point, you are just saying, I don't want any money. And yeah, there's no additional credits, there's no additional benefit in waiting after age 70. So yeah, so we do recommend that if folks are going to wait, come see us at least by age 70 so we can get your benefits started. Yeah.
Great, thank you.
How we doing on questions? Any other ones we need to address right now? Are we okay?
We're doing well, yes, thank you.
Great. All right. So, oh yeah, I should say, I think you saw at the bottom of the slide there. Uh-oh, I went too far. Come on, there we go back. Let me make sure. I always have to promote our calculators, right? So if you're not sure about those earnings, you can use our retirement calculator there to kind of, play around with some different scenarios. Okay. And so what counts for those earnings limits, right? It's implicit in the name, it's earnings. What are you making from employment, right? What's reported on a W-2, or if you happen to be working as a self-employed person, what on your tax return, what is reported as net earnings from self-employment, right? So we're not looking at rental income or other pensions or benefits or things like that. Those are not earnings when it comes to this earnings test. Okay. And there are some instances where you might receive a special payment from your employer after you retire, some type of sick or vacation payout, some type of severance or bonus. And that's not because you worked extra hours, right? That's just kind of a special payment. And so you would need to report that special payment to us, right? If you're going to continue to work and actually have earnings, so that we can properly annotate your record to show, hey, we know we're going to get this earnings amount reported to us, but this portion of it represents a special payment. Okay? And there's a section on our website that goes into more detail about that kind of proof and how to submit that to us. Now, while you may be able to, start making your millions, when you reach your full retirement age, anytime you have income, Uncle Sam, right? The IRS is always interested in your total amount of income. And so Social Security benefits are no exception from that, but it can vary from one person to the next, right? So when we talk about taxation of Social Security benefits, what the IRS is looking at is your adjusted gross income. So what you and or your spouse may be making from work, any non-taxable interest income. So investments, dividends, I'm not sure what all goes into that category. I'm no tax professional, right? And then if you have started receiving Social Security benefits, only half of the amount that you receive in the year from Social Security will go into this equation for your combined income. So this is a pretty straightforward equation, right? It's easy to see that if you're able to minimize your income in one of these three categories, then by turn, you will also minimize your tax liability. So what do I mean by that? Well, that's why one of your decisions may be, I'm going to wait to add Social Security benefits to this mix until my income in one of the other areas goes down. Right? So you may not be able to totally avoid taxation, but if you can spread it out, over time, that can be wise, right? And so obviously Social Security is not in a position to give you guidance about, taxation and how much taxes will be and how much you'd have to pay. But there are some publications available on the IRS website that talk more about this topic, right? And can give you some more insight on that. We have those there shown on the slide and available at irs.gov, right? And so when IRS is computing your combined income, right, they're looking at, this income and they're like, all right, this is what they have going on. And your Social Security benefits may be taxed if your combined income falls within the following categories here. So if you're filing as an individual and your combined income is at least $25,000 or more, or if you're filing jointly and your combined income is at least $32,000 or more, that is when you would have to pay income tax on a portion of your Social Security benefits. All right.
David, we do have several questions.
Let's go.
Please explain the special rule the first year you retire as it pertains to earnings and possible reduction of benefits.
Okay. In the first year that you file for benefits, right? We're not going to count any earnings that you had before you start your benefit, right? So let's say someone comes to us in October, right? And they want to start their retirement benefit. We're not going to penalize you for any earnings that you had prior to October, right? So we're only going to be concerned about your earnings from October forward. So your earnings limit would be the yearly limit divided by 12. Whatever the yearly is, divide that by 12, and then that would be your monthly earnings limit for the remainder of that first year. In the following years, then you would go back to the yearly limit.
Thank you.
Mhm.
There's a question too. What about income from a farm?
If it's reported on a W-2 or as net earnings from self-employment, that is what would matter. Mhm.
Great. Then a question from earlier, is it gross wages that we paid FICA on? What if we have deductions that aren't taxable? Are those wages in the gross amount?
Yes, you pay Social Security taxes on your gross wages. If there are any other deductions, then that would be a question for your employer as to when those deductions are made. Yeah.
Great, we're all caught up.
All right. Those are good. Good questions. So that's perfect. We're all caught up, right? So we can go right into Medicare. Okay. And so we're going to kind of move away from the cash side of the house or cash benefit side of the house and talk a little bit about a Medicare, which is the nation's federal health insurance program. Got its start back in 1965. And when Medicare started, it consisted of two parts, also known as Original Medicare. That's Part A, which is hospital insurance, free for most folks who have worked and paid into Social Security. And then Part B, which is medical insurance, covers you comparable to routine medical care, doctors, visits, specialists, etc. Since 1965, right, Medicare has expanded and grown. There are now Medicare Advantage plans, which include Parts A and B, but they also offer additional coverages. Most of them include a prescription drug plan, known as Part D plans. They may have other benefits like vision, hearing, dental, etc. But don't be fooled by the name Advantage. Right? It may not be an advantage for you to enroll in a Medicare Advantage plan. Okay? And there is no requirement that you have to enroll in one either. You can have a prescription drug plan outside of a Medicare Advantage plan. There are also Medigap plans that meant to cover things that original Medicare does not necessarily cover. Okay. So there's a lot of options, and we don't, this Social Security does not manage Medicare coverage in that way in terms of where we know exactly how much it covers and what it covers of what cause. But Medicare.gov is your website to go to for that kind of information. And I'm going to share some other resources here too before we're done today that can help you navigate these waters. Where Social Security is involved is in determining who is eligible for Medicare and getting them enrolled in Medicare A and B, right? Parts A and B. So to be eligible for Medicare, most folks become eligible at age 65. But if you've been entitled to disability benefits for 24 months or more, or if you've been diagnosed with some type of kidney failure or ALS, also known as Lou Gehrig's disease, you could become entitled to Medicare earlier than 65. Okay, so that's the basics of eligibility. Now let's talk about your filing options. This is the part where sometimes there's so much fear and confusion out there. And we're going to dispel a lot of that here today. Social Security is responsible for getting you enrolled in parts A and B. And you have some options. You could say, you know, I just want to file for Medicare right now, and I'm going to wait to get my cash benefit at a later point in time. Maybe you're holding out for those delayed retirement credits, okay, or for that higher benefit amount. You can do that. You can say, I just want to file for Medicare right now. You can also say, I just want to file for Medicare Part A right now. And again, Part A is hospital insurance. It's free, right? For most folks working paid into Social Security. Covers you if you have a stay in a hospital or some type of skilled nursing facility. So you could say, you know, I just want to file for Part A right now, and I want to wait to file for Part B when I no longer have coverage through my employer, right? Because I'm still working and I have coverage through my employer, or my spouse is still working and I have coverage through my spouse's employer. You can delay enrolling in Part B. Sometimes there's fear out there about that, right? So I want to make that clear. Now, there are 3 enrollment periods that determine when you can file for Medicare. We're going to take a closer look at these, okay, in the following slides here. So, go ahead, Jenny.
A question did come through. If you choose a Medicare Advantage in the beginning, are you able to go back to original Medicare if unhappy with that Advantage plan?
I believe you are able to make that change during an open enrollment period. That would be a question to research on the Medicare.gov website, because Social Security is not involved in getting people enrolled in Medicare Advantage plans.
Thank you.
But I do believe that you can make changes for sure. So when we look at these basic enrollment periods for Medicare A and B, okay, you have your initial enrollment period. This one makes the most sense, right? It's around the time that you turn 65. 3 months before you turn 65, all the way through the 3 months after your 65th birthday. If you don't enroll during your initial enrollment period, you have 2 other options to enroll. You have a special enrollment period. That is for individuals who can show that from age 65 forward, they have maintained group health coverage through an employer based on active employment. Those 2 things have to be proven, right? So the moment the employment stops or the coverage stops, that is when the clock starts ticking, right, for you to get enrolled in Medicare without any kind of penalty. So as long as you can show that you have maintained employer-based group health coverage based on active employment, whether it's your own employment or through a spouse, you can enroll in a special enrollment period, right? And that's for, I mean, there are people sometimes who don't enroll until they're in their 70s, right? Because they've been able to maintain that employer-based coverage, you know, and so it's okay as long as you can show and document that. If you're not able to show that proof, then you have the general enrollment period, and that happens every year from January through March. Okay, so we're going to take a closer look at each one of these enrollment periods on the next slides. But before we move forward, it's important to know that the IRS has a particular rule that involves HSAs, right? So if you have an HSA, which is a health savings account, the IRS has a rule that says you cannot make contributions to an HSA and be enrolled in Medicare at the same time. If you don't have an HSA, you don't have to worry about that. okay? Or if you're going to stop making contributions, that's fine. But sometimes people want to prioritize making those contributions to an HSA, right?
David, are you familiar? Does that ruling also apply to the employer contributions? So if you have an HSA, but your employer puts contributions aside to it, if you've enrolled for Medicare, does your employer have to stop their contributions to your personal health savings account?
Great question. I am not sure about that, but the IRS publication that addresses this issue, I believe it is 969 is the number of the publication. And it talks about HSAs and that rule, and I'm sure there would be some guidance in there about that. Mhm.
Great, thank you.
You got it. Okay, so let's take a closer look at these enrollment periods. The initial enrollment period is pretty straightforward, right? If you enroll in one of the 3 months before you turn 65, then your coverage, would be effective when you turn 65, right? And when we talk about coverage being effective for Medicare, it's always effective the first of the month. Okay, so there's no partial months or stuff like that. Okay. If you enroll in the month you turn 65 or the 3 months after 65, then your coverage will be effective the following month. Right? So that's pretty straightforward, right? It's not a lot of mental gymnastics we jump through on that one. When we get to the special enrollment period, right, this is where there's a little bit more of a window. Again, to be eligible for the special enrollment period, there has to be that marriage or that connection, if you will, between employer-based group health coverage and active employment. The coverage cannot be based on retiree status or COBRA coverage or anything like that. As long as you can show that connection, right, from age 65 forward, you can enroll in this special enrollment period. And you have some choices, right? Because sometimes your employer-based coverage may not be ending immediately, right? So you can choose one of the, first day of the month after you enroll or any of the following 3 months, okay? And once, like I was saying earlier, once that employment stops or that employer-based coverage stops, that's when you have this 7-month window or 8-month window to enroll in Medicare without any kind of delay or penalty. Okay, so you do have there is some wiggle room here during the special enrollment period. If you're not able to show that proof of coverage, then your general enrollment period is going to be your option. Again, every year, January through March. And then your coverage would be effective the month after you enroll. I know there's always a fear and talk out there about, ooh, you better sign up for Medicare because you'll get a penalty. This is where the penalty could come into play. If you went without Medicare, meaning signing up for Part B, okay, and you went without it for 12 months or more, right? So let's say in April of last year, right, you no longer had employer-based group health coverage, right? And let's say you waited until April here this month, right, to file. You would pay a 10% penalty because you needed to enroll, right? You did not enroll within 12 months. Okay, so that is when a penalty could apply. Okay, so I like to share that in these presentations because there's always that fear out there as it relates to Medicare. Okay. So the goal is sign up during that initial enrollment period or special enrollment period. So you don't even have to worry about this general enrollment period if possible. Okay. So when you are ready to sign up for Medicare, you can do that online with us. You don't need to come into our office or do an appointment over the phone unless that's your preference. And in the cases where you're filing under the special enrollment period and you need to submit that proof from your employer, that you've had that coverage, the forms are available on our website in case your employer doesn't have them. You can complete those and submit those to us. Right? And we give some instructions here. This is a snapshot from our website. Give some instructions on how to submit those documents to us so we can get you enrolled.
With regards to leaving active covered employment and being eligible for Medicare, how do I avoid being without coverage if I leave employment during the middle of the month?
Well, that would probably be a question best addressed for your employer, because Medicare doesn't provide any, partial months coverage as it relates to those situations. So you would want to make sure that you coordinate that well with your employer if possible. And then if not possible, then perhaps there are some options available through the marketplace.
Thank you.
Mm-hmm. Great question. There's also some other maybe questions that come up when it comes to Medicare, right? Some folks think, well, you guys know I'm turning 65. Do I really have to do anything, right? Do I have to submit an application? Yes, you do. If you want coverage, if you have not filed for benefits before, you do need to take action. But you are automatically enrolled in Parts A and B if you start receiving benefits before age 65. Okay, so in that sense, it is automatic. Yes, we know you then, and we'll automatically enroll you in Parts A and B. And you still have the right to refuse Part B, right? Like, because you may have that coverage through an employer. Maybe you're still working or your spouse is still working and you have that coverage. You can still refuse Part B, but you can't refuse Part A. Okay, and so that could be an issue if an HSA is involved, right? If you're trying to make those contributions to an HSA, you would not be able to make any additional contributions to your HSA. Okay, so again, if an HSA isn't involved, you don't have to worry about it, right? But if you do have an HSA, you do not want to file for benefits, any kind of benefits, cash or Medicare, until you are ready to stop making contributions to that HSA. Okay.
Question came through. What is the benefit or downside of not enrolling in Part B during your initial sign up? Why would you refuse? Why not just be double covered?
That is a very valid question. And the answer to that is going to vary from individual to individual, right? Some people want the double coverage based on their conditions. Maybe they have some pretty serious conditions. Some people just want that double coverage because, hey, peace of mind, right? But I think a lot of people choose not to do the double coverage just because you're pretty much paying for the same type of medical coverage. Most employer plans are either comparable to or better than Medicare coverage. And so I think that's why a lot of people just say, why should I pay another $170 a month or so, for coverage that is already working for me. So totally an individual choice. But there's no disadvantage per se in delaying Part B, as long as you have that other coverage.
You're not breaking any laws by having both.
No, you're not breaking any laws either way. Yeah, you're fine either way. Yeah.
Thank you.
Yeah. So with that, let's continue to move forward here. This is a snapshot of the Medicare website. right? Kind of newly redesigned. Again, this is where you're going to want to go when you want to learn more about what each part of Medicare covers, how much it covers, that type of thing, those types of details. Of course, they have some sign up information on here too, but they really defer to Social Security, on that. When you go to that section, it'll be like, contact Social Security, right? But you'll get some basics on there too. Okay. So that's the Medicare website. That's kind of the look and feel of the Medicare website. And I did promise to share a resource that can help you navigate all of this, because let's face it, you don't file for Medicare many times in life, so to say. We don't retire many times in life. We need a little help sometimes. And there are state health insurance programs, also known as SHIPs, in all 50 states, and they are mandated by the federal government to provide free personalized counseling, right, with these Medicare choices, right? They're unbiased. They're not going to try to sell you anything. There's no commission. This is not a sales enterprise here. This is purely informational. And they are really good at helping you navigate, should I enroll in an Advantage plan? What prescription drug plan should I choose? That type of thing. Okay, so we encourage you to visit that website there, shiptacenter.org. Here in Missouri, the name of the program is called CLAIM, Missouri CLAIM. Sometimes in different states, they have different names, for their program. So they're really great. And we as an agency work very closely with them, because they contact us sometimes with questions and things like that.
On that note, real quick, I'd like to put a plug in. We will be hosting a webinar with Cindy Carr, a Missouri claims
Good,
specialist.
yeah.
Yes.
I know
Thank
Cindy.
you, David, for this. Good. Yes. Mark your calendars, members. That is scheduled for May 23rd at 2 p.m. Registration is available on our website, the Missouri Loggers website at this time. So thanks again,
That's
David,
great.
for sharing this.
Yeah, no, I'm glad you guys have them coming in. They know their stuff, man. They're on it. Yeah, and Cindy's a real gem. So that's great. So, we took a look at the Medicare website, shared that great resource, about Missouri Claim and the SHIP centers across the country. This is our website. And if you're wondering about it, well, it's kind of new. If you've been on our website before but haven't been on in a while, we did a nice redesign here, I think a little bit before the first of the year. And the goal here is to really make sure that you're able to get to what you need to get to quicker, right? And so when folks are ready to prepare for benefits, we've got that right there front and center when you need to apply, and then after you apply, right? Managing your benefits and information. Okay. So we're not going to go through all the things on the website today, obviously. We don't have time for that. But what I want to highlight is creating your My Social Security account. Hopefully some of you have done that already. If you haven't, I'm going to give you some tips on how to get that accomplished, because it's really a great way for you to always have access to your information. Maybe if you're meeting with a financial advisor, you forgot to bring something with you, you can just pull it up on your phone, right? And kind of keep moving. So if you don't receive benefits, the biggest advantage is getting in there to look at your Social Security statement, looking at those estimates, those benefit estimates like we talked about earlier, making sure that the earnings that we have posted for you are correct, right? Are we missing a year or more of earnings, right? Because you want to get that corrected before you file for benefits, right? Maybe you need a replacement Social Security card. Maybe you want to do some benefit estimates with the calculators and kind of figure out some different scenarios. These are things that we don't want people waiting unnecessary amounts of time on the phone or in one of our offices to try to do, because these are things that you should have at your disposal, right? And so these are some of the biggest advantages of having your account. This is what it looks like when you get in there, right? You see your name at the top and some messages, preferences, settings. You can immediately print or save a copy of your Social Security statement, right? Maybe you want to download it, share it with your financial advisor. There's some retirement ready fact sheets there based on certain age ranges. And you can also look at your eligibility and earnings, right? Did you work enough Do you have your 40 credits? Looking at your full earnings record for that kind of information. And then when you pull up your social security statement, this is what you'll see, right? It's a newly redesigned statement. Some of you may remember the old ones that had several pages and a lot of text and a lot of reading. We try to condense it and make things a little more specific and visually appealing. And then, as you can see, there are links to portions of our website if for folks that want to do a deeper dive into a certain topic. Right. So if you haven't looked at your statement in a while, I encourage you to log on and check out your statement, see what's in there for you. And when you go to log in or create your account or sign in, of course, we're going to ask you for your username and password if you already have an account. And if you're creating a new account or signing into an existing one, you will need to verify your identity through one of two sites. That is login.gov or ID Me. These are third-party verification sites that many government agencies are using, right, to verify identity. And so you'll have to create your account through one of those sites. Then you'll be redirected to our site, right, to kind of complete the login process. This is kind of a snapshot of what the login.gov site looks like. Okay. You'll be asked to kind of verify your identity, log in, and then once you complete the process there, you'll come back. We'll be able to send you an activation code, right, through the email or the phone number that you provide us, and then you'll be able to get into your account. Very similar to probably what you do for your personal banking or any other type of kind of financial site that you may do business with. Right. And so when you're ready to file for benefits, you can do it online. You don't need an appointment to file with us online. The online retirement application takes about 15 to 20 minutes to complete. That's usually quicker than it would be to call us and wait on the phone to speak to someone to get an appointment, which probably may not be available for another 30 to 40 days, depending on the office. Right. So so we really encourage folks to file online with us, but we know not everybody can, file online for one reason or another. And so if you do need to call us to schedule an appointment, you can do that. The appointment can be done over the phone or it can be done in one of our offices. So we're here to serve you in the way that you desire. So we just don't want you to have to wait too long. So if time is of the essence, right, filing that online application could be advantageous.
David, with regards to my Social Security account,
Mhm.
an individual did freeze his account due to fraudulent activity. Can he now go to Social Security online to create a new account, or will it require visiting Social Security office to file for benefits?
Yeah, no, you would not create a new account. Because you froze the account does not mean it was gone away, right? Doesn't mean it doesn't exist anymore. So you would just contact us to unfreeze or unblock access, right? And then you could use the online tools to file your application.
So simply by calling Social Security, they can help to unfreeze the account so he can log back in. Okay.
Correct.
Thank you. And then you mentioned, yes, indeed, in-person visits are welcome. And to my knowledge, local offices throughout Missouri are now open since the pandemic. Is
Yes.
that correct?
Yeah,
Okay.
all of our offices have been open since last April, I think.
Okay.
Yeah, I can't believe it's been a year.
Wow.
Wow. Yeah. Yeah. So yeah, all of our offices are open to the public. We still may have some capacity issues at times, depending on the office, right? Because we are still trying to, follow COVID precautionary measures. So if COVID levels are high in a particular area, masks may be required. Because of capacity issues in some of our offices, you may be asked to wait outside, right? If you're trying to visit one of our offices. So be prepared, right, for that. Mhm.
But it is encouraged to call and make an appointment first. Is that correct?
It's encouraged to file online. And then if need be, right, if you're not able
Yeah.
to file online, then yes, please give us a call to schedule an appointment, right? You're not able to file for retirement on the spot when you walk into an office because, yeah, it's just, yeah, it's busy times in our offices. So,
Thank you.
And so I'll share one website or kind of a resource here as we wrap up. It's mymoney.gov. This is a federal website that is designed to educate the American public about various financial topics. So again, you're not going to be sold anything here, but if you want to learn more about, saving and investing, protecting your money, there's some great tips and some great resources that the federal government provides here for us. So free of charge, good information. There's even some resources on here for youth, right? So if you're wanting to try to instill a greater sense of financial literacy with your grandchildren or loved ones, you might be able to find some great resources there. And other than that, a shameful plug to follow us on social media. I promise we post good stuff, right? The nugget of information we share might be just what you need or a loved one needs. So please feel free to follow us on all the outlets. If you know anybody that's a good worker and is passionate about helping people, we are hiring nationwide for a variety of positions, from IT to claim specialists and so forth. So visit us on LinkedIn for those kinds of details. And we got some cool videos on YouTube too. So check us out. We're trying to be where the people are. So yeah. And so with that, I'll be quiet. So I know we answered a lot of questions along the way, but if there are any others out there, any other kind of feedback, I'd love to hear it.
Very good. Thank you again, David. And thank you to our membership for joining. I understand if you need to leave, again, I will be sharing a recording of today's session. Please allow for up to a week to have that emailed out, but it will be sent, or at least a link to access it will be sent within a week's time. We do have a question that has just come through regarding web. I have worked since 1981, but for 9 years in the early 2000s, I worked as a teacher in Texas and did not pay Social Security during those years. There is a note under web that says that doesn't apply if you have 30 or more years of substantial earnings not covered by Social Security. How is substantial earnings determined?
Excellent question, right? If I could say substantial, there we go. Okay, right. Those kind of earnings, right? Substantial earnings are a specified dollar amounts for each year, right? In previous years. And if you use the WEP calculator, or you actually look at the WEP, I forget where it is on our WEP informational page, but we have a chart of what the substantial earnings are for previous years, right? So, so what you would want to do is, and the WEP calculator would actually walk you through this, right? In the WEP calculator, it will ask you for information about the pension that you may be due from that time when you worked as a teacher, and then it will evaluate any Social Security covered earnings and compare that to your earnings for, your Social Security earnings for that year in relation to what the substantial earnings amount was for those particular years. So what, in essence, what that means is, if you have 30 or more years of Social Security earnings at or above the specified substantial earnings for those years, then you're fine. WEP would not apply to you, right? There would be no reduction in your Social Security benefit because of that non-covered pension. And so that's what our WEP calculator does. You'll actually be able to look at that. But great question.
And David, would you be comfortable sharing a copy of your PowerPoint presentation that I could send out in addition to the recording of today's webinar, so members can refer back to it for those wonderful websites you've been sharing?
Sure. Yeah, that's fine. I'll send you a PDF version after we get done here today.
Thanks. I know a couple members have asked for that now, so I appreciate that. Here's a question. I was told there was an extra $100 a month if you served in the military between 1957 through 2001. Is this true?
Great question. Yeah, so let's talk a little bit about that. So in some of those earlier years, like the late 50s, maybe a few in the 60s. It's been a while since I've been in the claims space here and had to evaluate military earnings. But in some of the earlier years, military earnings were not properly credited to Social Security records, Social Security earnings records. And so what we would do when folks would file for benefits is we would ask if they had any military service, right? So that we could make sure that their earnings record would be properly credited in case it had not been, okay? And so that did not necessarily result in an extra $100 a month, right, in terms of a Social Security benefit, but additional earnings, right, as part of that earnings computation that we talked about earlier would result in a higher Social Security benefit. So yeah, so that's I think that's where this individual may be coming from. Great
No
questions
further
today.
questions.
I know we had some good ones today. You guys
We did.
made sure I knew my stuff today. I'm like, all right, I haven't had that one in a while. Those are some good
Put
questions.
your 18 years of experience to work there.
Exactly. I see some other ones that have come in here too now.
Yes, my husband is 2 years younger than me. If I apply at 62, when can I receive 50% of the benefit difference?
Well, if you apply at 62, we're going to pay you what you're due on your own earnings record first. When your husband files for benefits, we will see if you are due a spouse benefit. And so, again, it's kind of like the example I showed earlier, right? Your maximum benefit, not what you're getting at 62, but your maximum would have to be less than half of his maximum to be eligible for a spouse benefit. So, depending on what those numbers are, you may or may not be eligible for a spouse benefit. We have a spouse benefits calculator on our website that you can use to kind of figure that out. So you would need your spouse benefit, you would need his information as well as yours to use that calculator.
And does that spouse benefit affect the spouse's benefit? I believe you mentioned earlier it does not.
It does
she
not.
qualifies or he qualifies for it.
Right. He would still receive what he is due, and you might receive a little extra.
There you go.
Yeah.
Then the military has given me 100% disability rating. Does Social Security have a rating for that when I retire?
That's great. Yeah. No, it does not. The disability determinations are kind of like another, we didn't really talk about that as part of Social Security today. So that disability rating from the military is great, like right on. I'm glad you got that. That would only come into play or be something to consider if you were filing for Social Security disability, right? And if you were filing for Social Security disability benefits, then we would ask, do you have a rating with the VA? We would use that as part of our own disability determination process. So, but that rating does not have any impact on a Social Security retirement benefit. So, great question.
And another question here regarding taking benefits, a reduced benefit. If I claim benefits before full retirement age and still continue to work, I get the reduced benefit for that earnings. But once I hit full retirement age, am I still limited to how much I make, even though I claim benefits early?
There is no earnings limit once you hit your full retirement age. The IRS will always care how much you make, right? But there is no earnings limit or earnings test once you hit your full retirement age.
Regardless of if you have
Re-
already filed for Social Security benefits or not. Once you
Correct.
reach your Social Security full retirement age, at that time, whatever you're earning does not impact your Social Security benefit.
That is correct.
Okay,
Mhm.
great. You've probably answered this, but is loggers offset against Social Security or vice versa? Or can we count on receiving both our loggers and Social Security? I think this is with regards perhaps to WEP for that offset. And again, if you work for an employer who also contributes to Social Security, per loggers, you'll be eligible to receive full Social Security benefits and your benefits through loggers. However, if you work for an employer in a position that is not covered by Social Security, that is when you could be impacted by WEP, that windfall elimination provision, and that would create an offset to your Social Security benefit. Your loggers benefit would still be calculated in accordance with your employer's elections, but it could have an impact to your Social Security depending on whether or not you have those 30 years of substantial service or whatnot. Does that sound accurate to you as well, David, to best answer that?
It sure does. And it seems
Okay,
like they got it too. They said, thank you, that
good.
makes sense, right?
Yes, glad that made sense.
I know,
Yes.
right? It could be a lot to digest, right? When we're
Yeah.
talking about those elements of the retirement scenarios there. Yeah. And then I see the other question there. Yeah, I don't understand the total family benefits line on my statement. Great question, right? So for those of you who have looked at your Social Security statement and it says the total benefits we can pay your family, what that means is that's the total amount that not only we can pay you, but any others who may be eligible for benefits on your record, right? So remember earlier in the presentation, yeah, a couple of times we had those slides up and I was saying, when you file an application, we're going to ask, do you have any minor children? Do you have any disabled adult children? And do you have any, current or former spouses, right? So that's what's meant by total family benefits, right? That's the maximum amount that can be paid out in benefits on your record. Great question. And then I see, yeah, another one there. Uh-oh.
Oh, it appears David may have exited by error. We'll allow and see if he's able to join again rather quickly here. But again, thank you all for your attendance today, and we appreciate you taking the time. Remember, this will be shared as a recorded link likely for you to access and watch again in the future, as well as a copy of that presentation for you, so you can refer back to the websites that David shared throughout. If you go to mologgers.org, you can access our upcoming events as well as the events calendar. Remember, Missouri Claim will be here with us on May 23rd. That is a Tuesday at 2 p.m. And so again, we hope that you find this beneficial. Loggers, we administer your retirement through loggers, but we again recognize that we are just a piece of your future financial picture and are happy to provide and being able to provide these for you. And I'm sorry, I don't see David back to help answer this last question that came through, but the question is, if you want an in-person visit, how much time before filing should you make an appointment? Very good. Just in the nick of time, David's able to join us again. Allow me a moment to get him the correct abilities here.
I'm back. Oh my goodness.
Welcome back.
I'm telling you, that was a good run. That was a good run. I don't know what happened at the end there, but okay.
Oh, and we were just getting to that last question. How much time before filing should one make an appointment if they're wanting to meet in person?
Sure. Generally we say you should file 3 months before you want your benefits to begin, 2 to 3 months before you want your benefits to begin. So depending on the office, your servicing office, their appointment calendar may vary, so if you called an office right now to try to get an appointment, they may not have an available appointment until sometime in late May, right? So, you know, it just kind of depends on the office. Yeah. But generally we say we want, if you want to file that application 2 to 3 months in advance, that allows us enough time to process, to review in case we need to get additional documentation from you for some reason. If we need to, correct your earnings record, or if there are things like that, discrepancies, that gives us enough time so that you're not being delayed in terms of benefits.
Great. All right, David, I think that is all of the questions.
All right.
Yes, thank you again so much for your time and devotion to America and Social Security and helping us. Is there anything, words of wisdom you've learned or things you'd like to share further?
Yeah, I say just breathe in, breathe out, smile often. It's going to be okay. Retirement's going to be great. You're going to figure it out. And you've got great people, like Jenny and others to kind of help you through it. So just breathe in, breathe out, no worries. And yeah, enjoy. You worked hard, right? Get ready, have some fun. Yeah. Mhm.
Very good. Well, thank you. And again, membership, thank you all for joining us today. If you have questions after the fact, of course, don't hesitate to reach out to Social Security Administration, or if they're loggers related, reach out to myself or our team here with Missouri Loggers. Thank you all. Stay safe and take care.
Thank you.